Hey everyone, this is Dr. Matthew Hernandez, and you're listening to the Ethos Athletes Podcast, where we provide resources to help you stay active and healthy. Today, we're going to be continuing our performance optimization series with Dr. Warren Brown. And if you've missed the last two episodes, the very first one that we brought Dr. Brown on kind of goes over the general big picture of performance optimization and a few things that we're going to be covering in this series. And then in the very last episode, we talked about the first factor of performance optimization, which is gut function. Today, we're going to be discussing energy production in the athlete and how they can improve energy production to improve their overall performance. So Dr. Brown, welcome to the show.
Hey, Dr. Matt, thanks again for having me. It's always great to speak with you.
So for those of you who don't know about Dr. Warren Brown, he has a private practice here in Scottsdale, which is called Clinical Advances for Sport. And he's been helping people since 2012, helping athletes address and reach the highest levels of health and performance through his advanced clinical approach. And so if you want to learn more about him, you can check in the show notes and the links, and we'll have a link to his website. So Dr. Warren, can you go over just a quick recap on the 6 things we're going to be discussing when we're looking at performance optimization?
Sure, certainly. So we talked about gut function last week and how important that is. Today, we're going to talk about energy production and some of the nuances of that pertaining to athletes. I also, as part of my program, address hormones, which I call cell signaling, detoxification, immune responses, and structural issues, mostly from the genomic aspect. So those are really kind of this formula that I've put together over the last few years and really tried to refine my approach towards athletes and whittle it down to a formula, essentially. So that's those are kind of the main areas that I focus on when working with athletes.
Awesome. So today, as I mentioned, we're going to be discussing energy production. So can you tell me a little bit about what energy production means to you and what you're looking for in an athlete and looking at helping their performance?
Yeah. So when producing energy, we're basically breaking down fats, carbohydrates, and proteins that we eat. We're ultimately doing that for the purposes to make ATP, adenosine triphosphate. And this is a process that ultimately you could call it oxidative phosphorylation, but basically the production of ATP is the energy currency of the cell. So we have to have it, and it's involved in lots of different biochemical processes, moving things across cell membranes, moving things around the body, moving the structures in our muscles from a microscopic standpoint. We need ATP to do all of that. We need it to maintain DNA and lots of other things. So it's sort of this energy currency that we use. And so it's critically important for every living cell in the body, especially muscle cells. So it's produced in the mitochondria. That's the sort of the powerhouse of the cell, as you know, and it's some pretty complex biochemistry that's involved in making ATP. So there are these biochemical pathways that are involved in ATP production. They occur in sequences, and these sequences are mapped out. They're well known. The Krebs cycle, the citric acid cycle. What's cool about that is that we know the sequence. We know that there are nutrient cofactors and coenzymes that drive these pathways and that make the sequence work. And we even know some things that inhibit the pathways. So, and we'll probably touch on that in our discussion of the detox aspect of my program. But the good news is that there's some advanced testing into how well these biochemical pathways are functioning, and that's where we can intervene and optimize them. And so that's really what I focus on when talking about energy production, is mapping out those pathways, seeing If there are any slow spots, buildups, any issues with conversion from one step to the next, and we can target those areas. And that's what I do in the energy production aspect of my program.
Awesome. Now, as you mentioned, and energy production is essentially the production of ATP, and that's done in the mitochondria. And for listeners who are familiar with the show, in one of the previous podcasts where we talk about weight training with Janet, we actually talked about mitochondrial, how weight training actually increases mitochondria in muscles, and increasing that also increases the amount of energy production. And and energy production is essentially when people talk about metabolism, that's one of the aspects that we're talking about. So these are all really important aspects to, or the mitochondria are the center of energy production. So making sure that they are healthy is very important in order to make sure that we're healthy overall. And there's a lot more to mitochondria than just like from a performance aspect. There's like an anti-aging aspect that it's associated with, and maybe we can get into a little bit later on.
Mm-hmm.
But because the mitochondria are so important, knowing if there's something wrong with them, or how to test for mitochondrial function, is very important. So can you talk to us a little bit more about those tests?
Sure. Yeah. Urine organic acids, they look directly at these key steps in the biochemical pathways that are involved in energy production. And these are intermediates within the citric acid cycle. Through organic acid testing, we can look at a couple markers that tell us about fatty acid metabolism and glycolysis as well, which is sort of upstream from the citric acid cycle. And these are, we all learn about these citric acid cycle in high school biology, and then we see it again in college biology and maybe biochemistry, and then again in medical school biochemistry and physiology. And it's because it's that important. Surprisingly, though, it's pretty rare that conventional healthcare providers are using organic acid testing. So especially considering the increasing number of diseases that are being associated with mitochondrial dysfunction. So like Alzheimer's, cardiomyopathies, diabetes. There's some auditory and visual problems that are associated with mitochondrial dysfunction as well. So there's a lot of data on it, but it just hasn't seemed to fully make its way into the conventional healthcare setting. And so that's one of the reasons why I think it's why people need to come see people like you and I. At any rate, I've been using this tool for almost 10 years now, organic acid testing, and I couldn't imagine practicing without it. It's sort of become a specialty of sorts for my practice.
So can you tell us a little bit more about like what organic acids are, and maybe give an example of how it can roughly be interpreted, like how this test, like what can it tell you? If you can give like a patient example.
Yeah. So organic acids are, well, the organic part of that word means that they have at least one carbon atom. So it's carbon based.
Mm-hmm.
The acid part has acidic properties, and that's sort of the simplest way to define it. But in functional terms, these various different organic acids that we can test for, in some aspect, they'll mark a particular pathway, biochemical pathway. And if we see an accumulation of a particular organic acid in a given pathway, then we're able to infer that there might be some inhibition at that step. And so if we're seeing a buildup of something like citric acid, then we know that there are some nutrient cofactors involved in converting it to its next step, like iron and glutathione. So if we are seeing a buildup in citric acid, we might think about supporting with those particular nutrients to try and get it to convert into its next step a little better. And ultimately, those nutrient cofactors are supporting an enzyme that makes that conversion for us. So it's basically trying to get more functionality out of the enzymes that make these conversions for us, because if we're seeing buildups in a particular pathway, that's a sign of inefficiencies in that pathway. So, so that's sort of how the testing can be used. And of course, we always want to put that into context with clinical presentation and try to get a sense of the overall function.
Yeah.
So, but that's sort of how the test is used. It's basically looking for buildups in a particular analyte and knowing what is required to convert it to its next step.
Okay. What are some of the ways that, like, how would an individual know, like, oh, yeah, I might have an energy production problem? I'm assuming like fatigue might be one thing, but what are some other things that they would be experiencing as a symptom wise to understand that?
Yeah, you're absolutely right. Fatigue is issue number one, typically. Sometimes it's brain fog. Sometimes it's, I would say, maybe even slow healing process, perhaps.
Okay.
But yeah, number one is definitely fatigue. Um, it's, there's really no particular part of the body that a patient would point to say, well, this doesn't feel right. Maybe it's my mitochondria. It's really, this is kind of like the generator in the body. This is energy production. So I would say fatigue is probably the number one symptom that people might feel.
Okay. Um, one important thing, just going back to like mitochondria in general, there was a doctor in medical school that he made this. It was like an offhanded quote in a lecture he was giving, but it was something that kind of stuck with me. And it was, if his quote was essentially, if you figure out how to fix the mitochondria, you'll be able to help the patient significantly, or like you'll make a huge difference in that patient's life. And so I think that kind of goes with just saying how important mitochondrial health is for any given person. And again, kind of along the lines of just optimization of, if we go and look at this to make sure it's optimized, then the better off we're going to be down the road.
Right. It makes perfect sense. Yeah.
So what we talked about organic acids, and then as you mentioned, in biochemistry, we have certain enzymes and everything that that need nutritional cofactors, or basically need certain vitamins and minerals to help push that pathway along and break everything down the way you were mentioning, to get us ATP. When we're looking at ATP and energy production, what are the most important nutrients? Like, I know, B12 is people get B12 shots because it's supposed to help with energy, right? How much of a truth is there to that? And then also, what are the other important nutrients that are responsible for ATP and energy production?
Yeah, the B vitamins are really important, especially B1, B2, and B3. Magnesium is important. Manganese is important. We talked about glutathione and iron. CoQ10 seems to be really important as well. So all of those are ones that we can draw most closely to the citric acid cycle directly. So, and that's really kind of at the core of energy production. But you mentioned B12, that's supportive. There are other nutrients that sort of feed into the citric acid cycle that are involved. So there's a lot of different nutrients involved. And of course, the macronutrients like fats, carbohydrates, and amino acids are feeding into that citric acid cycle. So it all kind of works together. I like to use the analogy of a car engine. I think it works well for this because the vitamin and minerals are kind of like the spark plugs, and you need a strong spark for every cylinder in order to fire on all cylinders, so to speak. So the engine fills with fuel and air, which would be food, essentially the fats, carbohydrates, amino acids, the macronutrients. But that won't necessarily make the engine run correctly if those spark plugs aren't working right. If the spark is not, strong enough, it's not going to burn that fuel very efficiently, and the engine won't run right, or you won't get the best fuel efficiency. So it's that engine is not going to win any races if there are not the nutrient cofactors in place. So yeah, I mean, I often get that question about, okay, well, why don't I just take B vitamins and glutathione, magnesium, manganese, iron, CoQ10? Um, First, the first reason why that's not a good idea is because some nutrients like iron we can overdo. So they can become toxic and they can create oxidative stress if we don't need them. So iron in particular, we have that problem. So that's one reason why we wouldn't just take iron without testing it first. Second is the shotgun approach, where we're just taking a bunch of different nutrients. It really, I find it's not personalized enough to really be effective at optimization. So someone with a diet that's low in niacin, if they're taking a multivitamin with niacin in it, it may not be enough to really make up for a deficiency or push a pathway in the right direction. The dose may not just be high enough. So I think that's maybe the second reason, is that the shotgun approach isn't really personalized. And lastly, the shotgun approach can also be pretty expensive. So
Yeah.
I'll take this and I'll take that and I'll take all of these different nutrients, and all of a sudden you're at $500 a month in supplements, and it starts to even displace some of the food that's coming in through the diet. So I think there's a few reasons there that a targeted approach tends to work the best.
Yeah, no, I completely agree with that. Yeah, I had a patient who came in and had mentioned, like, okay, well, if what's the exact quote that she used? Is basically like, okay, well, if this vitamin is good, then more of it must be better. So let me just take as much as possible. And I was like, no, don't do that. Like that's there's so many things that, like, so many factors you have to attribute, or that can happen with that, right? And you have to take into account. And what you said, one, the expense, and then two, just, are you overdosing on, obviously not going to die of a vitamin, like you're not going to die of a vitamin overdose by any means, but like you can cause negative impacts to occur. And so that's something that needs to be taken into consideration when you're looking at stuff like this.
Hmm.
And in addition to just like the absorption, right? Like your body's only going to be able to absorb so much. I'm imagine, that you've seen that as well in some of the testing that you do.
Yeah, and that ties in pretty well with the digestive piece of my plan too, because if I've even seen patients who are supplementing with nutrients who, because of their poor digestion, they're not able to digest and absorb those nutrients, even in supplemental form. Sometimes that
Right.
can be a problem. So it does, if we're taking nutrients orally, we really do have to have the digestive capacity to break them down and assimilate them.
Yeah, no, absolutely. One thing that we haven't discussed that is very much tied to some of the B vitamins is methylation. And I know you wrote an article that talks about how muscle function depends on methylation. Can you explain like what methylation is and why it's important?
Yeah, methylation does have ties to energy production as well. So methylation, just sort of in the big picture, is essentially moving a methyl group from one molecule in the body to another, and in doing so, that triggers a lot of different. It's used all over the body for all kinds of different purposes, but it's not particularly fancy biochemistry, but because it's used so often, billions of times every second, it has a huge importance. And methylation is basically uh, the conversion of one aspect of it that we often talk about is the conversion of homocysteine to methionine, and the cycle that's involved in the body, because there's some some nuances related to that require B vitamins like folate and B12, and even B2 and B3 are important in that. For athletes, it's important because the part of some of the amino acids that are involved in methylation, like glycine, arginine, and SAM, are used to make creatine. So somebody who's a very poor methylator might not be making much creatine, and creatine is critical for muscle function. So that's one aspect of just methylation. It's not directly related to energy production, but it is really important. The part of methylation that is related to energy production is basically converting homocysteine into some of the other amino acids like cystathionine and cysteine and taurine. And that ultimately leads to energy production as well. And pyruvate is involved in that as well. So it's really complex in terms of the amount of things that methylation touches, but the biochemistry itself is pretty straightforward. And that's also something we can test for as well. So it's really a fascinating, there's been a lot of data coming out about methylation over the last 10 years or so. And there's nutrient cofactors involved, there's genomic mutations, which we'll probably talk about when we cover structural integrity later on. So there's a bunch of different aspects involved to methylation, but it is involved. It's partly involved in this energy production piece.
When you mentioned that there's certain testing that can be done, what testing have you seen to be effective when you're looking at this for methylation in general?
Well, there's some tests that can be done conventionally, like homocysteine. We can measure that in blood. Mm-hmm. It's been used kind of as a proxy of, is this patient methylating well? I think it's a good marker. It's a cardiovascular risk marker. It's generally used in that context. But I think it is part of the story. There's some more pieces to the story that we can check in the blood by looking at some of the amino acids and their metabolites that are involved in methylation. So things like methionine and SAM and SAH, SAH. Mm-hmm. And then we can measure amino acids like taurine and cysteine and glutathione. So there's a panel that also that the lab that I also work for has put out recently that's really shed a lot of light on methylation. And I don't think we talked about that yet, but I'm part of what I do in addition to my practice is consult with a laboratory. So this is a panel that it's called the methylation panel. And it's from Genova Diagnostics. And that one has been the most comprehensive look at methylation that I've seen so far. And you even have the option to add in some genomic SNPs to that, which can really sort of answer the question about why we might be seeing some methylation dysfunction. So it's a complex process, but this panel has really sort of shed a lot of light on different aspects of methylation that we really hadn't previously thought about. And that panel just came out earlier this year.
That's awesome. When we're looking at, going back to energy production, I get patients that come into my office who have had labs, like they went to a doctor and doctor ran comprehensive labs, and some of those labs included like like B12, red blood cell folate, stuff like that. How accurate are those blood tests compared to some of the other ones that we can use to check for B12 status and folate status?
Yeah, great question. Their short answer is not that useful. Right. I don't think they're that accurate. I think there's vast fluctuations in B12, in serum B12, serum folate, that are really not capturing the essence of the need. And things like Methylmalonic acid is much better at that. Methylmalonic acid is an organic acid
Right.
that if we're B12 deficient, some studies indicate that that's a more reliable marker of need for B12. So because it exists in a pathway that's B12 dependent. And if we're lacking B12, then that marker might start to elevate over time. And even the Mayo Clinic laboratory handbook mentions a few studies that suggest that that's a more reliable marker than B12 in the serum. And I totally believe that because I'm sure you've seen this too, where a patient brings in a result for B12 from another provider, and it's a serum B12 and it's showing high, and they're like, "Oh, it's high. Why? I don't need any more B12." And yet you give them B12, and then their symptoms start to go away.
Right.
So it's really it's like, it seems like if a patient has even just a green salad prior to getting their blood drawn for B12, it seems like it's going to be high. So I haven't found a whole lot of use in it. And I suspect also it might have to do with how the reference ranges were established, because generally the conventional laboratories, when they set up reference ranges, are looking for, they're oriented more towards catching disease, showing disease patterns rather than health patterns. So in a broad sense.
Yeah, no, that makes complete sense. Is there, what do you call it? In medicine, there are good ways to test for things and there's bad ways to test for things. And some doctors still use like the inferior way of doing it, right? Like in the example I gave of a patient who comes in with serum B12 and serum folate. They might do serum folate now that I think about it, because RBC folate's usually somewhat decent-ish.
Yeah.
But yeah, like what is it that what are some of the factors that can make lab testing inaccurate? Like certain tests like that just inaccurate in general.
I think part of it is maybe the fact that some of them are simplistic. For instance, a serum B12, well, if it's normal, it doesn't necessarily really tell the full story, because there's some complex biochemistry involved in utilizing B12 in the body. And so if we just capture a snapshot at one point, then it's really it's maybe an oversimplification. So I think that's part of the issue.
That makes sense.
I think another part of the issue is that some of these things might not be as stable as originally thought. So they might, like that example of a patient having a salad, the day before the test, and their B12 shows up high the next day. That serum B12 might fluctuate pretty quickly from one day to the next. So I think it may be accurate in the sense of, yes, it's measuring the amount of B12 floating around in the serum, but how well is that getting into the cells, and how is the mitochondria involved in that, and how are some of the other nuances involved in B12 metabolism, like amino acid metabolism, so that's B12 dependent. So I think there's a multitude of factors, and that's why I think organic acid testing sort of, for me, it really elucidates a lot of the peripheral information around the needs for B vitamins in particular.
That makes sense. I mean, so on my end, when we're looking at someone's hormones, there's a difference between just doing like a TSH for your thyroid hormone that comes back normal,
right?
But you're still experiencing weight gain, fatigue, hair loss, stuff like that. And then when you actually go and dive deeper into, okay, let's look at what's happening to your T3, your T4, your reverse T3. Oh, okay, now we found that, yeah, you're producing enough thyroid hormone, but you're actually not utilizing it super well. And so in that case, like, on labs, you have normal thyroid function, but on the basic labs, you have normal thyroid function, but in reality, you're not utilizing it well. So you are considered hypothyroid. So if we give you thyroid medication, and in those cases, we give the patient thyroid medication, and, they start to feel better right away. And
Yeah.
so, what you said of it being simplified to just like, what's your B12 level? There's a difference between how much B12 do you have in your system versus how well are you utilizing it. And the former, or the serum B12 only tests for the former, not for the latter. So that makes complete sense of what you
It's
said.
a great point. Yeah, great example with the thyroid. Yep, I completely agree.
Awesome, perfect. So we covered energy production. The star of energy production is mitochondria and the health of the mitochondria. And so, in order to test for how efficient your mitochondria are, the test for that is going to be a urine organic acid test, where we can look at, again, how well are the mitochondria functioning by looking at all the different um, cofactors and metabolites that are needed in order to produce ATP. And then from there, we find where the problem lies, and then can go and supplement or make adjustments to or make recommendations that will help improve that process to make you more, or to optimize your mitochondrial health. Is that the good summary of everything that we discussed?
Great summary.
So then Dr. Warren, is there anything else you want to discuss on energy production?
No, I think we've touched on it and hit a lot of the main points. So yeah, I think that's a good summary.
Cool, perfect. So we'll go ahead and wrap up this episode then. On the very next episode, we're going to be discussing, we're going to continue with the performance optimization series, and we're going to be discussing cell signaling and hormones. And so we'll have Dr. Warren on again for that, to discuss that piece. Dr. Warren, thank you so much for being on the show.
Thanks again, Dr. Matt.
Everyone, hope you enjoyed the show, and we'll catch you on the next episode.